Rule 1, working in NDIS, be honest, as James said, what you do, why you do, what you can offer. If you can't be honest enough that you're a new provider and you're still sitting down, trust me, it's going to be very hard for you to find a client. To learn anything new, to go out there to ask anyone, okay, help me, I need to find a client. You can't get any. Do I see anyone still sitting down? Okay. The ones who are standing here, new providers, how many of you find what James said is completely a new information that you did not think of, the possibilities in the NDIS sector? Raise your hand. Higher. Go up. We need to see the difference. Keep your hands up. Now from the rest of you, keep your hand up. Rest of you who found the information about the quality and compliance, the difference, and can it really be made easy, as Tanya said? Is that a possibility? How many of you did not know? Keep your hands raised, previous ones as well. Any new ones? That has been exactly my journey 7 years ago. I had no idea where I was, what I was doing, what was I getting into. The first client, I've been thinking a lot from what James said, what Tanya said. I've been thinking about my journey and my slides and my presentation. The day I got my NDIS registration, or the day okay, let's go back to the day I made an application for the NDIS registration. I had no idea what it is. I was doing cleaning services, and the only reason I made an application to NDIS was for household tasks. What was I supposed to do? Cleaning. That's it. It was just an extension for the services for what I was doing. The range of services I got into doing from there on was self-care, community participation, support coordination, plant management, SDA, sale. I was getting into therapeutic supports and behavioral support. Belinda here has seen my journey. Yes, my journey. Yes. I've known Belinda for nearly, 5 years? A little bit just over 5 years. She's seen my entire journey. I had no idea what I was doing, but sometimes I would ask Belinda, the support coordinators that was working with Belinda, sometimes I would ask them back in 2020, 21, can I pick your brains on this? I just got this query. Why this? Why that? How does this happen? Somebody likes it or not, you need to ask a question. That is one of the reasons why you're here, to try to learn, to try to understand. I'm not going to give you any of my clients. I can take over like 100 new clients tomorrow, but I promise I'm not going to do anything else. I'm going to concentrate only on core supports, self-care, community participation. I'm not going to say I'm going to buy and take over your plan management business. No, I don't want to do it. I want to do what I specialize in. Something what James said, what do you do? What are you here to offer? I would add another dimensional question to it. Why NDIS? Why are you in it? What do you know about NDIS? All the new providers here, can you raise your hands again? Higher? How many of you still think that you are here, keep your hands raised if you're new, okay? Let me complete the question. That you think that you are an NDIS provider and you provide a range of services, whether you registered or not. That's okay. But that you can do self-care, you can do sale, you can do cleaning, you can do maintenance and gardening and everything. How many of you think you can still do it? Good. How many of you think that you can do only 2 or 3 things or 5 things tops? Gentlemen here, what service is best that you can do? How many clients you have? Okay. Home improvement. What's the hourly rate on home improvement? An hourly rate. NDIS rate by the hour. Sorry? Good. How many of you here, the new providers, is wanting to do self-care, and how many of you actually do not know the exact per hour rate for the self-care? Raise your hand. That's fine. That's fine. What is the per hour rate for self-care, assistance with self-care? Do you know that? Good. Learn that. That's the first step. What do you do? What industry do you come into NDIS from?
I'm not an NDIS thing. I'm pretty much into property maintenance.
Yeah.
But my partner, she's the one.
Next to you? Good. What industry were you in before NDIS?
Project management.
Okay. What is the hourly rate in project management that you get paid for, or a company charges a client? Either $80 an hour or $100 an hour. What is an hourly rate for assistance with self-care? Okay. You need to find that out. So she's assuming that it is going to be $50 to $70 an hour. So, I've got a client for you. What are you going to charge me? Simple question. You're here for a client. Let's say somebody up here gives you a client. What are you going to charge?
At least making the money that we get from our job.
No. No. You can ask for $80 an hour. I'm sorry, my friends. NDIS is not going to pay you $80 an hour. Not in this year. Not in the next year at least either. Not even from the 1st of July 2026 to the 30th of June 2027. I don't want to say what prices are coming out in July, but I do have some sort of an idea about the exact prices that's going to be. But is it my stage to say? No, it is not. So the first thing you need to find out is what price. So because I went into NDIS only for cleaning, I knew it was $47 something that was being paid. $47.30 that was back then in 2018, 2019. And it's gone up to about 50, 55, something like that. My team looks after it. I help them with the overall management and making sure the operations are getting done. Vashi back there somewhere, yeah, right there at the door. She looks after the entire accounts and numbers with me and the compliances and making sure the paperwork is up to the scratch. Through the entire journey, I went through offering so many different services. Back then, I knew exact numbers. So my friend, if you do not know, that is $67.56 for assistance with self-care, community participation and the core supports. You can't do your maths. If you can't do your maths, you cannot run the argument about making enough money to be able to pay your bills because you don't know how much you can get paid. Then going into the operations and getting through the journey, how are you going to do it? There's no way. So I've been through a lot of that process. I'm helping out the other businesses. This is my way of giving it back to the community. That has given me something to live by, live with. Something to be proud of, something to be standing here, sharing some sort of a knowledge and understanding through the hard work, sleepless nights. Talking about sleepless nights, I did not sleep last night, by the way. So I could not get an idea or a thought out of my mind. I did not. Belinda does not say she understands. We do not get sleep, good sleeping nights. My problem for the last 2 weeks. There's so much to do. As a business owner, it comes back on you. If I'm doing cleaning, if I'm doing any support coordination, I'm doing sale, whether the support workers and the service manager, like Tanya said, has filled out the information or not. Yes, Tanya, my still house service managers have left because they cannot fill out the 10 damn documents. Or just review the simple thing. Is there enough information? Does the information corroborate with the one that was filled out before or yesterday? Is the same person is only one person filling out, or just talk to the rest? Please fill the proper information. We need the things on paper. Maintaining quality, no problem. But maintaining quality on paper, where somebody else can actually come in, knock on your door, and want to drag that paper out of your book and judge you on it, that judgment, which direction is going to go, is a part of your compliances, whether you're really getting it done or not. Part of the journey, part of the process, I find a problem. That's the problem here. Can anyone relate with it?
Cannot speak, I guess. See or listen.
Yes, people don't want to see what's happening around them. People don't want to talk or tell another person sitting next to them. People don't want to listen to the person sitting next to them about any new knowledge or the information that is out there. Without you share the knowledge, without you understand the knowledge, the 50 different services out of the 800 different line items on the NDIS, how are you going to work together? How are you going to look after one particular participant who's actually looking at 50 services? Well, you are here to offer 50 services as an NDIS services provider, but you can't even get a client for one single service. Imagine that participant juggling between 50 different providers, and they cannot have one provider to provide all those 50 services because of conflict of interest. Yes? Are you with me? Who's not with me? Raise your hand who's not with me. If you got a question, just raise your hand. I'll come to you. I would love doing this today. Getting Tanya and James speak before me is giving me so many thoughts and so many different ideas, and looking at a lot of different faces sitting at the corner, I can see who's not following. So yes, there's a lot of that information we need to share. We need to get rid of this problem. If that 50 different service providers looking after one disabled person is not talking to each other, is not sharing the information on paper, an allied health professional not talking to another allied health professional, and the third one, I'm talking about a physio, and then an OT, and then there is a dietitian, there's a nutritionist. Is there a difference between a dietitian and a nutritionist? Not you. Not you too. Not you either. The first time, years ago, when I came around that terminology, I was like, Well, many years ago, 20 years ago, 25 years ago, I read Easy English, something like that, or Learn English the Easy Way. So the word, the way it ends in dietitian and nutritionist, have got two different professions and two different meanings, but you separate the words and you've got two different things coming out of it. I started with that. I said instantly, no, there is a huge difference. I had no idea exactly what I was talking about back then. Whether you need to refer a participant or you need to ask a provider to help you with a particular participant, whether that particular provider can actually do that particular service for that participant that you are looking for or not, or whether you can work with that particular provider or that one of the service agents from that particular organization or not, are completely separate, unrelated questions that you have to answer when you have to work with different organizations. There will be instances when you can or cannot work with one particular support coordinator or one particular OT from one particular organization, but you can work with another one from the same. It's an individual you like or you don't like, or a relationship that you can have with one particular family member. You can't have the same one like with your sister or your brother. Yes or no? Follow me? Same thing goes with looking after a particular participant. You have to cook for your family member. But you have husband and wife have to cook dinner for your children. Either a husband cooks or a wife cooks. Yes? Is there ever a disagreement? Yes? I want to eat noodles. Nah, let's get just rice. Food. But it's a difference of opinion. Yes? Samantha, can you give her a mic?
Hi everyone, my name is Rohini and I'm quite new to NDIS. I have a question. Like, we have talked about everything. We have talked about the support services, disability workers, cleaning, gardening, everything, OT, PD, occupational allied health, physiotherapist. And I haven't heard anything about community nursing, which plays a great role. So could you please explain me about that?
Most of us are referring those particular allied health and support coordination titles is because those are the people that you need to look after. Those are the people that you need to satisfy to get another client if that is what somebody is looking for.
Yeah, but if they have some specialized needs,
they always do. Let me put it this way. They always do. Most of the providers, the new providers, they've got no idea about nurses. Now, you coming from a nursing background, you being a nurse yourself, a registered nurse, with the tone that you're talking, you know better about nursing.
Yes.
But nursing is not as simple. There's a registered nurse, there's an enrolled nurse, there's an educator, there's a lot of different levels.
It's quite complex.
It is very complex. And then there is a level of what sort of nursing you do, whether you do a mental health nursing or you do medicine. I'm not asking, this is for these people. I know the difference.
Okay.
But nursing, like assistance with self-care, they are the core service provider who are looking for another client. But huge number of people here do not know the difference. And there is a lot many other services I can say. There's home modifications I haven't touched.
I just want to know
I haven't
more
even said about anything about gardening.
Someone mentioned.
Yes. Yes. So let's talk about that in 1 hour. Find me in 1 hour after 8. Yeah? My journey with NDIS, it started with Magnum Support Services. Do I have a banner here? It's somewhere around. Magnum Support Services, I started just for cleaning. Eventually we got into providing a lot of different services. I supported, Fiona here is another reminder for me from back in 2020. Yes, I'm putting you up online. Talking about you. Show them your face. Let's make it official. Stand up. Fiona walked up to my door after a certain SMS exchange, looking for toilet paper when the COVID hit. For the clients. What was I doing? I was looking for a client for cleaning services, but because I was in cleaning services, I was connected with the stockists, with the warehouses in Melbourne, in Geelong, in Ballarat, in Mornington. So what did I do? I started talking to people. Everybody is looking for a toilet paper. Nobody got a toilet paper. Nobody got a hand sanitizer. Nobody's got a hand wash. Nobody's got even the detergent. I mean, it's easy to find. Why can't you find it? Yes, because I was connected with those people. I made one call and I can get like 2 pallets of toilet paper. I make another call, I got a pallet of about 250 bottles of hand sanitizers while everybody's struggling, paying $30, $35, $40, $50 for 250 ml of a hand sanitizer. Come on. How many paid about $40 for a 250 ml of a hand sanitizer? Did anyone did that? What was the maximum somebody paid? Nobody even paid for a hand sanitizer. Nobody believes in COVID. Well, the virus does exist. Okay? Rohini, the nurse, can assure you about that. The virus does exist. I journeyed through it, but it got very complex. One reason or the other, with Wise Healthcare, as we are progressing into 2025 and the future, we have put these two organizations of branding together under the umbrella of Wise Healthcare, and we will be concentrating on core supports only, in-home supports. So what do? In-home supports. That's answering James's question. We started with a vision to empower NDIS participants because there was a need for a proper support by the disabled under the guidelines provided by NDIS and the price guide for them to be looked after by service providers as one of their own family members. Can we do that? I used to give this example to everyone ever since. If you are in this industry, you need to look after a particular participant like one of your own family members. So if one of your aged or a disabled family member is needing a particular support, would you know what is the hourly rate if you're getting a funding? That's step one. Whether you get a client or not, whether you find a support worker for your family member or not, does not really make much of a difference. But what is the hourly rate? Step one. So anyone who doesn't know the hourly rate of all the services that you are wanting to offer, make sure you remember them and make it by heart. Without you knowing the prices and what exactly those services require and are involved, you won't know. I just said I will be concentrating on core support services. What is core support services? I've got you the list of core support services. It's not only assistance with self-care or just taking somebody out into the community. There's a huge list. Out into the community, what is taking the person out into the community? What sort of household chores and tasks somebody really needs to get done? Can we do that? Yes. But how many people do need all of this? Huge numbers. Which ones of this is somebody going to be able to specialize in? Now, I did tell Rohini, nursing is core. I'm not including nursing in here. I've got nurses. I've got calls from nurses pretty much every week. Find me work. I'm happy to work with you on any sort of level, help you with the marketing. I'm sorry. I steer away from that. Allied health professionals, I've got people connected, support coordinators I'm working with, other allied health professionals, OTs, everything. No. Right now, Wise Healthcare is servicing in Melbourne, Sydney, Brisbane, and Adelaide. In Melbourne, we do have still in SDA houses that we are looking after. We do have some clients for support coordination. We are just taking a few steps back from a lot of different services to concentrate only and only on core and do that right for the participants. If we have to grow, we'll take some steps back and we'll just be content with it. But I would want to share all the knowledge and everything and all the resources and connections I've got here on this platform with you as we go. The resources I have built. I'm always happy to help out the small to medium businesses or any other businesses growing to help them how they can find their way forward. This was my story in short. I can go over that if you buy me a coffee or lunch. Cheap lunch to $15 lunch would do. I'll tell you more of my story. Done. Done. Anyone else for my second day lunch? 2, 3, 4, 5. Amazing. Why should take me off my wages? Just give me fuel for the car. I'll travel. I've got to pay rent and then my food is sorted for next 1 month. So
You don't have any dietary requirements, right?
no.
Clarify that.
No dietary requirement. No dietary requirements. After the sunset, no drinking requirements either. Or preferences. From my journey, I'll bring you back to this. This is my topic of conversation or discussion, what I'm supposed to be sharing with you. How does a business grow? What do you need to do? Whether you are coming from a project management or a real estate or you are a small new business into NDIS, you're a recently educated nurse or somebody who just thought of coming into this country and did a certificate 4 in disability and want to set up your own NDIS business. That's fine. But there is a way to do it. It all starts with a journey where you start from a zero client. What do you do as a first thing? Now this is a departmental contributions, okay? Business growth. You said whatever pays the bills. Somebody's looking for a client. Somebody's looking at, Rohini said service. Reliability. So what department in the organization is reliability? Absolutely. Samantha, where's the second mic? Yeah, pay attention. Come with me. Look around. Yeah, make that a priority. You're going to make me look bad when I talk about marketing. People who don't have a client or people who are looking for client or looking for knowledge to share or meet new people or show your face here, the step 1 in any sort of business is marketing. Yes? You want to start anything, whether there is enough client, whether there is a need for the service. First thing you start with is marketing. Get your cards printed for $7.50 at Vista Print. I have no idea whether the 3 to 6% increase in the cost of living every year, how Vista Print is still giving that $7.50 cards. I have no idea. But that is the step 1. You get your cards printed, you go out here, and you give your card to everyone that you shake hands with or everybody that you meet. Yes, Alex? Correct? I asked Alex to be at every networking event. She's coming all the way from Edithville. Just because I simply asked her, okay, you have to be here. I'm going to Edithville for her on Saturday or Sunday now. You reach out to a person, somebody you find in the market, in the area, in any of these networking events, or at a coffee shop, or or from a call center, or phone calls, cold calling. You get a participant, you get a client. What do? What is the next you need? You need a support worker. Somebody help me out here. I'm giving you all the cues here. I'm telling you how to run the business. Now everybody's a businessman here. Somebody help me out here. If somebody gives you a client, the question is, if somebody gives you a client reference, okay, this person needs a self-care, this person needs a community support, or this and that service, or even in real estate, I want to sell this property, or I want to buy this property, the first thing that you have to have is what? A support worker, staff, the human resources. You need to have somebody to be able to deliver that service, or you need to be available yourself to be able to deliver that service. How many of the small businesses have actually thought of actually going out there and really delivering that self-care services? I'm asking this to the new service providers. Have you ever tried that? Have you ever lived with the experience of disability? A lot of people, don't answer that question, that's rhetoric. I know that a lot of people have not done that. But step 3 is operation. So, okay, you've got a staff. What do? You get somebody in the admin to put in on the roster on the system, yes? And keep an eye whether it's done or not. Then it comes to quality management and making sure that things are getting done or not. If people are putting up the right information. But that stays within the quality, answerability, talking to the others. Then it goes to the accounts. The accounts' job is to raise the invoices, making sure you're getting paid and the staff is getting their wages. Am I right? Is there any other role for any of these professions or group that help you in growing the organization other than just doing the job right? Can anyone help me answer that? Sam? Mike right at the back. R&D, that's another department. Research and development, yes. But the question is that does an accountant, other than raising an invoice, does the accountant really, okay, let me break it down. Does an accountant help you with any sort of marketing? Does your admin staff help you with any sort of marketing? Well, you've got a marketing department, you've got 2 people in marketing, you've got 3 people in marketing, but what about them? Does an operations person whose job is rostering and exchanging email communications, is that person helping you with marketing? Indirectly, yes. Not really. A lot of people say no. But definitely for an accountant. How about hiring a support worker? Is that a part of the marketing? How? Sam, bring the mic. The one, yeah, bring it to her, then to her.
Support workers are your marketing.
Yes. And to the lady at the back?
Support workers naturally tell their friends and family who they're working for. They'll be like, oh, I've got a job to go to. And they're like, oh, which company? So naturally, they are marketing your business as well. If
Yes.
they've got a good experience with you, they're going to talk about the business that they're working for.
Absolutely. Let's go to the first thing. Human resources. Support workers. Support workers represent you when they are out there. The promises, the fake promises somebody's done, or the solid promises that you've done based on a confidence, your support workers, your team, talk to that client or that process whether you are delivering on your service or not. Are you going to deliver? It has nothing to do with the roster. Even if the person is late, the participant may or may not be happy, may be happy. The service delivery will go smoothly, but is the support worker looking after them in the rightful manner and getting the job done right according to what they're expected to do or not? If they are, they're supporting the promises made by the marketing team and all the efforts, whether it is a research of finding a job, a client, a niche, a demand, going out there, spending that fuel and everything, making a promise that, okay, we will deliver. That becomes part of your marketing and that becomes a part of your growth. You with me now? When you are working all by yourself, you know what you promise. You know what you are going to deliver and you know the sort of a support worker you need for that one participant who's coming to your need. What does the person need and how you need to get that delivery done. Correct? That becomes a part of your operations. And then when you raise an invoice, you know you promised 3 hours, but your support worker spent 5 hours, or you went overboard, but you can't get paid for another 2 hours. Now, either you bear that cost of 2 hours or yourself, or you find a way through so you eventually end up charging for that 5 hours. It is a process. But that communication is based on the initial conversation, the day one that you had, when you made a promise of a service delivery. Am I right? Now, this is nothing to do with NDIS as well. I'm saying it is generalized throughout every industry sector. Can you relate that to it? A boss who's got 5 staff, 10 staff in real estate, in project management, why do they get pissed off? Why do they have to throw somebody out? Because simple reason is they are not delivering. But to monitor the workers, when a boss or a person starts a journey himself, or just from one particular chair and an old computer, and eventually they end up getting like 20 brand new computers. And if people are not delivering according to what his journey has been and the promises that he's telling the marketing team or the operations and the accounting, managing the finances, is that the only job for a business owner? Is that the only job for a business owner, to keep an eye, oversight on everything? Yes or no? Yes or no? Leadership is not an easy job. You have to juggle between 50 things at once. Can you do it? How do you do it? How many here is thinking about, oh man, I needed to do the invoices, I should have brought my laptop? Well, I for one definitely am. I know that Vashi back there is for sure. So while I'm talking, she could have ran some accounts and numbers and stuff and done some banking here. I know for sure that's happening. But when I'm driving back, I'm thinking about, oh, what am I missing? Hang on, let me pull over, let me find that SMS and make that call, and then I'll hit the road back once again. Oh no, hang on. I need to talk to Tanya about inviting her into this event. This will be something very informative because of the process that I'm trying to work around. It's going to be very important for everyone who comes here. So what do? On a freeway, going out with family, I go left, pull over in an emergency lane, go into my task, make a note, call Tanya about doing this. I save, indicate right, get into the lane, start driving again. Has anyone else here done something like this before? You can't remember 20 minutes later when you reach your destination, right? It's just one of the stories. But I've got a huge, long list of journey spanning over 7 years within the NDIS sector. I've been wanting to get a job, but my background, I must say, I'm so impressed with Tanya's background. I don't know when Tanya, you get time to get out of the books. Like you got like 20 dozen degrees there. Yeah, 15 degrees. Like, look at you. You're definitely like 250 years old. In a few days' time. Happy birthday. Nearly getting to 40 in about 2 months' time. I haven't had those many degrees. I've been busy with operations and doing all of that stuff. But let's bridge the gap here. James has talked about possibilities, the vision, how you need to look at your business and your journey and where you can be. Tanya possibly can put you together if you contribute in that journey with her on making all the compliance and quality management easy. I've gone through her manuals multiple times. It becomes so easy. And the colors and everything, it just registers in your mind. So it's definitely very scientifically selected colors as well. James is always reading about new information. And I can give you a bridge between where you are now and going in the back office and putting all of those things into practice operationally, how you can do it. Would somebody want to walk that journey with me? Raise your hands. How much money have you guys actually put in your starting up your business, by the way? Can I ask? What sort of investment? Someone who's happy to share. Huh? Few a couple of afternoons. Yeah, that's how I started too. But how much money to get a client, or the money that you see that people are making in NDIS, how much money are you wanting to invest into NDIS? Or into running this business and really making it a success? Okay, let's say, not even just NDIS, somebody's from real estate here, somebody's from a nursing, somebody's, probably Rohini would want to end up doing a nursing agency or in another healthcare sector, in a DVA, or could be something else. There are lots of possible options. But how many have you invested about $30,000 to $40,000 and still not getting any results? Could raise your hands. One person, two, three. Yeah, about six. How many of you actually have spent about $20,000 and still struggling? I mean, this is including the cost of NDIS registration and everything. Including everything. And now when you start your NDIS business, you have to pay like $1,500 to your accountant to register a company, right? What if I get you together in a room with James, myself, and somebody else to give you some resources and all the information, but you need to give us a one day. Can you do that for us? Would you want to do that for yourself? There will be a cost. Today, I'm giving you free networking. That will be on a cost. Let's talk about leadership. Leadership is hard to define and good leadership even harder. Like, what was Alibaba's owner's name? I forget all the... Jack Ma. Jack Ma said, running a business is not easy. You have to work with, tomorrow is a difficult day. The day after tomorrow is a very difficult day. Now, today is a difficult day. Tomorrow is a very difficult day. But the day after tomorrow is a beautiful day. So, tomorrow never comes. He never tells you that. Leadership, running a business is not easy. There's a lot of highs and lows and ups and downs. So,